12 of the 19 cities in Contra Costa County, over 90% have been vaccinated. So I want to start and thank our community, our Contra Costa community of nearly 1.2 million residents, and our health professionals, and everyone on the front lines, and many others, whether in communities, for their efforts in protecting themselves and their community. I mean, how many things can you think of where nearly 90% of the public agree? And that number, close to 90%, have chosen to be vaccinated because they know that the vaccine is safe, they know it's effective, they understand the dangers of COVID-19. And in this country, over 700,000 people have died. In California, it's over 70,000. And in Contra Costa, it's nearing 1,000. They also know that nearly all COVID deaths right now in the United States are among people who are unvaccinated. And if every eligible person was vaccinated, we would have practically no deaths. So we are all, I think, have been pretty successful. But there remains a very vocal minority, and I'm sure we will hear from some of them today, who spread misinformation and falsehoods. And the reason we brought this resolution, Karen and I, is because we need to do more than just sort of let that misinformation stand. And I want to acknowledge our health department does have a page on its website called Facts and Myths about COVID-19 and the vaccine. So they've been putting out good information on this. I think we all owe it, because people are asking us to clarify the misinformation that's out there. I get inquiries all the time from residents who ask questions about what's fact and what's myth, facts and good information. So when people spread on social media, in their own conversations with others, misinformation, we need to call it out. For some lower vaccination rates in some communities, it's responsible for a higher number of hospitalizations and serious illnesses and even death. So the harm that is caused to others by misinformation needs to be called out. And I was recently at two churches in Richmond last Saturday, talking to two pastors who sponsored vaccine clinics in their community. And I want to acknowledge the faith community. They've been leaders in stepping up and talking to their own congregation and their own networks about why it's important to be vaccinated. You know, reaching the last 13% in our county to be vaccinated is a lot harder, right, than the first 13%. And the good work of these individuals helps. So people are voting with shots in their arms, nearly 90%. And so I want to thank all of them. And Karen and I know that other counties, I mean, we're not the first county to have this type of resolution declaring misinformation on COVID and vaccines a public health crisis. It started in San Diego County, and several other counties have joined them. So I want to end with two comments. We do have a great letter from the Alameda Contra Costa Medical Association, which was sent to us supporting this action. And they've said, we concur with the U.S. Surgeon General that health misinformation is a serious threat to public health. It can cause confusion, sow mistrust, harm people's health, and undermine public health efforts. They've also said, they've acknowledged that Unfortunately, throughout the COVID-19 pandemic, the public has been exposed to information that is false, inaccurate, or misleading. This misinformation has caused confusion and has even led some people to decline life-saving COVID-19 vaccines and reject public health measures. Misinformation has impeded our ability as a community to gain control of the virus and is widely believed to have exacerbated the most recent surge in cases attributed to the Delta variant. The good news is we can do something about it. And as the physicians in Alameda and Contra Costa have said, we call on Contra Costa residents to join us in the effort to curb COVID-19 misinformation. Residents can help by learning how to identify and avoid sharing misinformation, engaging with your friends and family on the problem of health misinformation, and addressing health misinformation in your community by working with schools, community groups such as churches, parent-teacher associations, and trusted leaders such as educators and healthcare professionals to develop local strategies against misinformation. So that's why we're bringing this. And again, thank you to the nearly 90% of residents in Contra Costa who voted by taking a shot in their arm to protect themselves and their community.